Hi, my name's Jack, and I'm a trans actor and director. I've had some friends who are pre-testosterone ask me about the voice work I do with actors. So I thought I'd make a quick video showing you some techniques that I use with transmasculine actors that have the sort of happy side effect of deepening their voices. I'm nearly 5 months on T myself, and I found that the voice work that I've done as an actor has been really useful for when my voice has been changing, slightly still all over the place. But I think I've definitely had a smoother transition in that department than many other people. I have some videos on my channel if you want to know how I sounded pre-T and kind of how my voice has changed. So what I'm going to teach you to do in this video is how to distinguish between your head, chest, and belly voices. Your head voice is up here. This is probably the closest to my pre-T voice, and it's kind of the voice that a lot of us go into when we're speaking to strangers or picking up the phone. Your chest voice is where you mostly speak. Most of the time when you speak, you'll be able to feel yourself kind of vibrating here in your chest. And your belly voice is down here. It's the voice I've been using for most of this video so far, and it's where I've been trained to access the bottom of my range. I'm going to walk you through how you can get down to this belly voice in a safe way. I've seen a lot of videos on YouTube where trans people have basically figured out kind of the basics of these techniques, but a lot of people are doing things that are damaging their voice, which isn't a good idea if you're pre-T or if your voice is changing. You want to take really good care of your vocal cords as your voice is changing to ensure that you get a really full, rich voice change in a healthy way. That means you want to really avoid techniques where you're grating or pushing sound out in your throat, where you're tensing your jaw or your neck. If you're talking like this, that sounds like pretty tough and Vin Diesel and masky, but it starts to kind of callous up your vocal cords, and it's going to make you lose your voice. So I'm going to show you how, as actors, people find their deepest, most resonant sounds in a way that allows them to go and do all of Hamlet in 3.5 hours. As a disclaimer, I've had professional training as an actor, and as I said, I do work a lot with trans actors, but I'm not a professional voice coach for theater or a professional voice therapist for trans people. This is my own attempt at translating some of the basics of the Linklater voice work that I've done, and kind of showing transmasculine people how they can use this to their advantage. I should also note you may not see a huge difference in the video that I'm about to show you between my sort of before and after voice. This is because I'm already speaking mostly down here, and this is where I've been sort of training my voice to sit. But if you are not used to doing that, and you practice this a couple times a day, you may see, hopefully you will see, a pretty dramatic difference in your own voice, especially if you're used to speaking up here in your head voice or in your chest voice. So I'm just going to show you how to do that. I recorded this next video the other day. I'd encourage you to pause it as you go along and just walk yourself through the steps, and please let me know how it goes for you. If you have any questions, just drop them below. The first thing you should try to do is just try to loosen your body up a little bit and breathe through your mouth. You get in more air that way. So try taking some deep breaths through your mouth and see if you can get them not to kind of be moving your chest, but instead moving down here. What I often do is literally like put my hands just below my belt and see if I can feel myself breathing into my hands. So you should feel your hands expand, and then as you breathe out, press back. Just try doing that a couple times. And make sure you're not sucking your stomach in. Just give it a little jiggle. It's fine. I'm doing this on camera for you. You can see I've got a little bit of a pot belly, beer belly. So yeah, just let it all hang out and make sure you're not tense. You can also put your shoulders down. Maybe roll your head a couple times. A lot of this is about just relaxing your body. So do some stretches if you can, and see if you can kind of open up your ribs here. If you can, roll down your spine. Try doing that. And come back up, letting your head come up last. And just kind of all about sort of letting your back and your ribs relax a little bit. Another place you can feel for your breath is in the small of your back. So if you breathe in, you should feel your hands expand and then contract. I want you to return just to kind of like breathing down here, just below your stomach. Just letting your breath drop in. You shouldn't be forcing it. You should just be able to breathe naturally. The easiest way to kind of find sound down here where you may not be used to speaking in your everyday is to kind of come downward. So we'll start up here, just like rub your face a little bit and kind of try to find your head voice. Just hum is the easiest way. So go ha-hum-ma, ha-hum-ma, and that sounds like weird, but just bear with me. And then let some vibrations go in your chest voice, so you can kind of knock along your collarbone. If you feel comfortable, knock your chest. Just hum again. Ha-hum-ma, ha-hum-ma. So you should be taking in a breath and then ha. This should just be all really easy. You're not going huh. You're not forcing the sound, just ha-hum-ma. And then just pat down and breathe. And kind of rub your stomach a little bit, and that will kind of guide your breath down here. Breath in. Ha-hum-ma. So you can see how my range just dropped down a little bit more now, because I'm breathing into here, and I'm accessing this kind of bigger resonating chamber. The sound kind of resonates in your body. If you're, just resonating in your nasal passages, you're just getting kind of sound. If you're in your chest, you get like a kind of probably like about where you usually talk. Sounds like the rest of my video. And then ha-hum. Don't push it. You shouldn't be making kind of like a sound. Stay relaxed. Keep your shoulders down. If you feel yourself tensing up, focusing, remember to breathe. Just let yourself go loose. That is something you may actually need to do, because this is, even though it's just a very natural breath and sound, it is a little bit weird if you haven't done it before. The way to kind of translate that deep sound into words is to hum and then go to a sort of text. So, ha-hum, 1, 2, 3, 4, 5. Ha-hum, 1, 2, 3, 4, 5. My name is Jack. I'm 4.5 months on testosterone. So you can see that my voice, and I'm speaking down here now, is a little bit lower. And it is something I can kind of push down even further. You can hear I'm really kind of accessing a different register here. This isn't really a way I would normally speak, but it is a way I could speak if that was sort of how I wanted to train myself to speak. Again, this doesn't really involve any pressure here. It's not coming from here. You'll feel a little bit of vibration in here, but not loads. Most of the vibration you feel should be here. So when you speak, you should feel yourself vibrating here. And that's when you know you're accessing that lower register in a safe way. If you have any questions about that, I'll probably post a couple more little exercises, but that's sort of the gist. And I'll post some links again for links you can follow further if you're interested in any of this stuff from an acting point of view.